Hi, my name is Albert Chiou. I'm a medical dermatologist over at Stanford. I serve as director for clinical research for our department and have been involved in a number of clinical trials in atopic dermatitis. And I'm excited to talk to you about one set of results from those today. Yeah, so these were results I was really excited to see as someone who takes care of patients with oftentimes severe atopic dermatitis. So we know that our first line therapy like Dupilumab or the IL-13 inhibitors or even our JAK inhibitors, not every patient responds to them or they could have some side effect or contraindication to them. So there is a significant need for treatments with different mechanisms of action that can rescue these types of patients. And I think they're becoming increasingly common. And so we were excited to see that in the patients who had prior systemic exposure, that there was a good response. In fact, on the poster and in the data, you can see that if you kind of plot out the response of patients who have had prior systemic exposure, those response curves behave very similarly to just a greater overall trial cohort. And we believe in this data because this trial actually had a pretty high representation of patients with prior systemic therapy exposure. It's more than a third of the patients. So that was intentional as part of the design. And so I think that's a really positive signal. We also did an additional analysis where we took all the patients who had been treated with the highest tested doses and took a look at folks who had actual documented past failures to other systemic treatments. And they identified six patients who had failed prior systemics. All of them had failed Dupi, and others had failed additional agents beyond that. Four of those patients ended up getting randomized to active treatment, and three of those four patients with prior systemic failures actually responded with improvement to Soquelitinib. In fact, two of them markedly so. And then two patients who had also previously failed systemics had been randomized to placebo. And what we saw is actually both of those patients ended up flaring on the trial, as defined as needing rescue medication. So I think this is pretty exciting that we may have a therapy that can be relevant for a lot of these patients who have failed other treatments. So this was one of the most encouraging parts of the trial is that for all of the tested cohorts, there is a very clean safety profile. If you look at the frequency of adverse events between the soquelitinib treated patients and the placebo treated patients, you can see it was very well balanced. When you look at the individual adverse events table, you can see essentially pretty mixed between active and placebo. So one of the aspects we were really looking for is there any infectious signal, any hematologic or lab abnormalities, and none of those were seen during the course of this trial. Yeah, I think it's just really exciting to see an oral medication that potentially has such a clean profile. I think we live in a world of trade-offs right now in terms of our atopic dermatitis treatments. We have highly efficacious oral medicines, but with, substantive safety considerations. And then we have very, very um, uh, good biologics with great safety profiles, but oftentimes some more kind of intermediate or some trade-offs on efficacy. So again, this is an early phase trial. We have later phase trials that are coming up. Just excited to see where the story goes for soquelitinib. But right now, we see really encouraging results for both safety and also for efficacy. So I think for an oral medication, that's something that's really exciting for us in the field.